Frequent flyer is a terminology that is commonly used to describe people who attend the emergency department or the accident and emergency department many times a year, usually more than 5 times in a year. My worry is that people who suffer with sickle cell disease or sickle cell anemia can very likely be given these terminology. And experience and studies have shown that people that are labeled as frequent flyers can very easily be stereotyped by medical staff, and when these patients are stereotyped, there's a high chance that their symptoms could be trivialized, and obviously they could come to harm due to delayed treatment or under treatment or just being completely ignored. Now, people with sickle cell disease, for reasons that are understandable, can very likely present with the emergency department multiple times in a year due to things like bone pain crisis or having chest infections or bone infections or any other sickle cell complication. And when these patients present at the A&E, they deserve to be given the appropriate treatment. Many a time this treatment entails using strong opioid medications for pain relief. So please, if you're a healthcare worker who is watching this video, make it a duty today never to trivialize your patient's symptoms. Always approach every patient as though that is their first time. Pay attention to all they're telling you and take their symptoms serious. Please and please and please, as much as it's possible, avoid using that term frequent flyer, just so it doesn't affect the way you begin to relate with your patient. And if you're someone who has sickle cell, please and please and please take it upon yourself to always self-advocate. Always make sure you are giving the appropriate treatment, and if you think your symptoms are being trivialized, ask for a second opinion. We've seen occasions where people with sickle cell disease unfortunately have passed on at the hospital in the emergency department because the staff who was supposed to administer pain medications or oxygen ignored them until their symptoms developed into irreversible complications. This shouldn't be happening.